Welcome to our second session in this series of three, where we are exploring ways as adult allies to champion with students through change. Today's session, as I said, session two, we're exploring how we might nurture transitions back from hospitalizations. We are a program project funded by SAMHSA, and though that is true, the views and opinions and content shared today is not necessarily reflected in the views of SAMHSA. I am part of a very fierce and incredible team, Melissa Smith and Amanda Lip, who you will be interacting with today. This offering, we're really rooting into how we might understand and address the unique challenges and experiences of young people as they return to school spaces. And then how we might also uplift the wisdom, the skill, and the strengths of young people and really include them in partnership.
Again, our topic, nurturing the transition back to school following student hospitalization. A panel discussion with our wonderful panelists here, Erin and Olivia. And I'll also be playing a dual role of holding the conversation and facilitating while also wearing the hat of a peer with lived experience. So we'll get into our introductions more in a little bit. On our next slide here, welcoming our wonderful panelists. Thank you again, Erin and Olivia, for taking the time and just all of your expertise and wisdom that you bring to the space. I'll first introduce myself and then I'll pass it to you, Erin, and then Olivia. Again, my name is Amanda Lip. I work for the Center for Applied Research Solutions as a technical assistance specialist, and I've had the honor of helping create this curriculum in this three-part series. As I mentioned, I'll be wearing the hat of facilitator and also peer with lived experience. When I was a freshman in college, I experienced a mental health crisis, and I spent 3 months in the psychiatric hospital system, cycling between ICU, inpatient, and outpatient services. So that very vulnerable time transitioning between senior year of high school to getting into college was very stressful, and I really kind of hit rock bottom, right? That was really a tough time in my life, but it led me to this space here, right? And I kind of joke that the hospital experience was like the internship of my life, learning from the inside out how the system works and how it can be improved. And then transitioning back into college and trying to integrate that experience and that lived experience as well, now informing my professional work. So that's a little bit about me and the perspective that I'll be bringing to the conversation. And now I'd like to pass it on to Erin to introduce herself, please.
Good afternoon, everybody. I'm really grateful to be in this space. My name is Erin Hughes. I am a school-based social worker in San Francisco. I'm the wellness coordinator at June Jordan School for Equity, which is a small public high school rooted in social justice values. And it's always interesting when I'm asked this question about my why, because in truth, I feel like every part of my lived experience is why I'm here. Um, and I think in an easier way of explaining it is that I went through a lot of experiences as a young person, and I witnessed a lot of extreme injustice in my city around me. And all of those experiences led me to want to find healing, wanting to find solutions and justice for communities, and many other steps along the way brought me into social work and wanting to be in school communities where our young people are. So that's what brought me here. And I will pass it off to Olivia, yes.
Thank you so much.
Yes, thank you. I'm glad to be here. My name is Olivia Hamra. I'm a child and adolescent psychiatrist at Georgetown University in Washington, D.C. Before I went to medical school, I was a teacher in a middle school in DC. I taught science and math to middle schoolers. And then decided to become a psychiatrist because of a big reason for that was because of what I saw when I was the teacher and how much I wanted to be able to help support those kids. As a psychiatrist, I work in an outpatient setting, and I also work as a school-based psychiatrist in multiple schools in different wards in Washington, D.C. So I kind of have this unique perspective of having been on the medical side and having been on the school side. And so that's kind of why I'm here, and I'm glad to be here with everyone today.
It's so powerful hearing your experience going from the school side to the clinic side, Olivia and Aaron. Really appreciate your vulnerability and your lived experience and how that really propelled you to be in this space. It really, I think, sets the tone for just the conversation we're going to have today, and what information, what wisdom, what tools, what insights have you both experienced that we can share today to really bring this conversation to light and inspire people to think more deeply about this conversation and how we can help students in this really vulnerable transitional time. And that may occur over and over depending on one situation, right? And how that might be across different systems, right? I'm very keenly aware that one of the first things my parents said was Amanda could have ended up in the hospital system, the jail system, or in the morgue. And that really hit me home when my parents told me that, because one of those three areas was where I was headed in terms of my crisis. So just bringing that to the fore to really just humanize the fact that where we end up in these different systems, it can really be is a reality, right? So I'd like to ask you both a few questions, and I'd like to really just kick it off here, Olivia, with a question for you, and then Aaron, I'd love for you to jump in and add your perspective too. Olivia, what role can school mental health professionals play in supporting a student's transition back to school? How can schools prepare staff and peers for a student's return following a hospitalization?
Yeah. And I mean, this is a big question, and I know Erin has a lot of probably more experience to speak to some of this. A few things that I'll, I guess, kind of kick off this discussion with is, from the medical side, I'm constantly preaching how important it is to get the schools involved in a child's care. I mean, kids are in schools a lot of the time, and schools usually know them pretty well. And in that way, I think a school mental health professional usually ends up serving as like the liaison between the hospital and the reentry to school and the school team. And a lot of their training also kind of helps them serve that role in terms of like knowing the language of the hospital system and also knowing the language of the school. And that is really, really important. So usually when we're thinking about a transition back to school, one of the really important things is to assign like a point person who can be the person who really coordinates that transition plan. And usually that ends up being the school mental health professional because of those unique strengths. And that would be like, and to be that point person between the hospital, the staff at the school, and between the student and their family, and kind of like bringing them all together to come up with a plan. I'll just start it there.
Thank you so much for sharing. I really appreciate your perspective and that emphasis on the shared language and the point person, right? So maybe we can hear some more examples of that. Would love to dig into that further. Aaron, would love to hear your thoughts too, and I'll just reiterate the question for you. What role can school mental health professionals play in supporting a student's transition back to school? And how can we prepare staff and peers for this transition back to school?
Yeah, I mean, I absolutely agree with everything that Olivia covered. That's the role I end up usually playing as the school social worker at my site, is that point person, because what we want to think about is the experience of the student. So if they have to have the same conversation with each teacher or with their administrator or with the school mental health professional or with, add in, right, all of the different roles you might have at your schools or in these systems, how overwhelming that might feel for a student, right? And so we want to really kind of hone in and find a way of how can we work through this transition in this process in a way that will be most supportive to the student's well-being. I think one of the things I might add to the list that Olivia provided is I also think how important it is to do preventative work. So another role that I sometimes play in my school is almost as like an educator, right? So in the ideal situations, part of my role in my school is to do professional development for our teachers and staff around safety issues for students, around topics like this. So hopefully I'm also kind of bringing resource and guidance and information to the team that I work with here on site, so they're best equipped to really think in an informed way about the students' needs. I think one of the things I often find is we can have such beautiful intention, right, in the way that we work to support students, and they can still have harmful impacts if we're not really thinking deeply about what their experience is. And an example of that is like, you know, I care about this student. I'm happy to see them return as their teacher. I want to ask them how they're doing. I want to check in with them. I want to hear, right? That is a beautiful intention to want to connect and support. Sometimes for the student, that might feel overwhelming, or like now they feel like they have to go and kind of give an update and share all of these things with all of these people. And that might feel too vulnerable and unsafe and be something that could create stress that would kind of push them away from coming back to the school. Another student might really appreciate that and feel like, oh, I have all this evidence that people are carrying on, you know. So it's, I think for me, in the role of kind of playing an educator as well, is kind of talking through those different scenarios and experiences so that I help our staff see all the different angles and perspectives or things that might come up for students so that they can really learn to hone in and kind of you have the student be the guide around what's the best way to support them. So that's another thing just to add in thinking about what our roles might look like in this work.
There's
Yeah,
such
and
great
with that,
perspectives.
oh, sorry.
Yeah, Olivia, jump in. Yeah.
I was just gonna say, like, without like something like concrete is for that point person to be in the meeting before the student is discharged from the hospital with the mental health care team, with the family, with the student. So important. Come up with a plan that sounds feasible. And then also for that point person to meet with the team at the school, the teachers, the other support people at the school, and relay that plan so everyone's on the same page. That communication is so key.
That's a perfect segue into what the next question was in terms of digging into some examples of what those protocols or communication procedures might be. And are these at the district level, the local level, in terms of sort of that crisis emergency plan, right? Sometimes we see those at the district level or the school level, and then all the way down to the individual level, 504 plans, IEPs, right? Transitions in terms of maybe there's a gender transition happening or something where there's more of an identity involved where we're adding in that aspect as well, right? I'm curious if you can dig into some examples of those tools, those resources, or even share a story that might illustrate how those protocols or tools work. A story about a student or a family or a situation where maybe it's reflecting on an individual case where a student, of course, without saying names and all that, but is there a particular story that might pop out for you that might illustrate this transition and maybe some lessons learned or some challenges that arise from that?
Well, I will say just in general, one of the things that seems to be really, really helpful is that a lot of times medical professionals don't always know about is this idea of like a 504 plan or an IEP. And a lot of times families and students don't really know
Mm-hmm.
that's something that's possible. Like, oh, I can have accommodations. I don't just have to jump back into school and catch up on everything and just be be a regular student again. And so being able to present those as options and use them to help the student like have a choice in terms of what, you know, how they can reintegrate into the school, how they can balance work and like academic work and mental health and mental well-being. That's something that can be really, really helpful.
Right. Yeah. Thank you for adding
I've
that.
seen that work well. You know, I think a lot of times kids want to just like, a lot of times they'll want to jump back in or, like just, forget it all happened. But really the month after hospitalization is really the highest risk time
Mm,
for a student. And so that's when we really just want them to take it easy and not have too much pressure.
right. Erin, you mentioned prevention and early intervention, thinking about the advocacy component. I'm curious if you can give us some examples of what you felt worked or what things resonated with students or teachers or administrators or mental health professionals on campus or even parents. And what are some examples of what that advocacy or education was?
Yeah, I feel very fortunate in the place that I get to do this work. Like I mentioned, I'm in a small school. So the intention behind the community I work in is to really get to know our students holistically and to really be centered around their well-being as well. So I know that that's not the case in many educational institutions. So I want to preface that I know for some folks, it's like a fight to get a couple minutes in front of your staff to present anything on these topics. But for myself, I have the privilege of getting a lot of face time to do a lot of
Mm,
training with our staff. And I think just even having space, even if, everybody doesn't leave some expert about how to do this, but I think holding space to have these conversations, to have our staff bringing their attention to the fact that we need to think about the what our students are really going through in their lives, right? Like, and how to be responsive and supportive of those things so that students are in the best position to be able to show up and learn. Because if we're not attending to any of those needs, right, like that becomes really challenging. It becomes a barrier. So to me, it's trying to do as much work early on in the school year, providing information, providing training, mentioning things to staff about ways they can get, further information, opening up all those lines of communication is really important. And then I also think that there's just some like training, some people do it around like that idea of like mental health first aid approach, like how to just give people the tools, whether they know specifically what the trauma is or what the need is or whatever, like really supporting people in learning what are the best ways for us to approach relationships with students that can be the most supportive and respectful of their needs. So we do a lot of that. And I also think it's really important to be bringing this information to our students. I think they are such a huge resource for each other. And so when we have the capacity to push into classrooms and do workshops around these types of issues, that equips our students with more knowledge and information to know how to show up for each other and for themselves. And that can be really helpful.
Really appreciate you sharing that, especially the training component with staff and thinking about how we can really get ahead through education and advocacy and thinking about mental health in that really holistic way, as you mentioned. I wanted to kind of dovetail on that and ask you a follow-up question, and Olivia would love for you to jump in on this one too, if you would like. Thinking about mindful ways to inform students' peers about what happened, right? Of course, this is going to the student's preference and their voice, their agency, and if they want to be open about things or if they want to be more anonymous. I'm curious if you have some examples of or some challenges or lessons learned from how to help the student transition with their narrative, their identity, like what happened, right? And I speak from this as a peer as well, where after my hospitalization, right, it was 3 months of being away from school where I would kind of use humor, right? Oh, I was at an internship at the hospital, right? Like this is just part of my psychology degree. And that was sort of how I coped and using humor to sort of propel through this conversation, but it was deeply challenging, right? So I just share that as a little bit of a story and example for I really struggled to find my narrative and my voice and how to tell my friends. And there was a lot of shame there, right? A lot of embarrassment, being sort of a straight A student in high school to now being a dropout and then trying to kind of get back on the wheel, right? So I'm curious if you have any examples of sort of what helped with this transition with language, protocol, and just voice. So Erin, if you want to kick us off here and offer anything.
Yeah, I think that's an important question and a tricky one
Mm-hmm.
because confidentiality is obviously such an important part of this topic as well. And And so what I would say is there's like a number of things that I'm asking students when we have that meeting to kind of support reentry and transition. And one of the most important questions I ask is related to this, of kind of posing to them, especially in a small school where people are really well known here and it's noticed that you're gone or, you know, whatever, right? I bring it up that you might encounter, you know, a number of people now that you're back coming up and wanting to ask you where you've been or what's been going on. And I'm curious how you're feeling about those conversations. What are you thinking about what you want to share? Is there a way you need support for that that would feel helpful to alleviate some of that worry and stress? So it's really just having those conversations with students to really hear from them what would feel supportive and helpful as they maneuver through that, you know, like interest or curiosity or concern from their peers or from their teachers. So one example that I can share is sometimes I will offer to students, like, it sounds like maybe you want people to have, you know, if they've shared this with me, obviously, right? That you might want people to have some sense of where you've been, but you don't want to have that conversation over and over again. And so then I offer, that's one of the things I can support students with, that if they do want to disclose some of their information, but don't want to take that all on themselves, then that's a role I can play. So I can go in and lead a talking circle with their class, or send messages to their teachers that say, you know, with the consent of this student, they wanted to share this aspect of their experience or where they've been, and they want to share what will feel most supportive to them around how to return. So this student might like to, you know, hear messages, you know, from you about how you know, they were missed, or, you know, different things like that. And this other student might want nobody to approach them or mention it. And that what will help them feel safe, that they want to initiate those conversations instead of those conversations being initiated by others, right? So I really think that it's important to take the time to have those conversations, because many of our kids, those are the things that are on their mind, of like, oh shit, like, how am I going to come back? And what are people going to ask? And how am I going to answer? And I want to be honest, but I don't want to share too much. There's so much going on sometimes internally, right, about stepping back into the school environment. So having that conversation along with their parents, so that their parents are also thinking about all those things that might come up for them or their family or caregiver, and taking the time to have those conversations can be really important.
I really appreciate your individualized approach and how every student is going to have a different preference or idea of what that looks like in terms of language, narrative, identity, coming back from this experience that was likely very trying, right, and very challenging. And how do they integrate that into the school environment themselves? And then you make a great point of the family as well. And is everyone on the same page with how to talk about this? So going back to that conversation around language, right, that Olivia was bringing up, that shared language between the school and the hospital as well. So I'm curious, Olivia, if you have any thoughts to add here too, in terms of that identity, agency, voice, while also being mindful of, right, of course, confidentiality, data, things like that.
Yeah, I mean, one thing to just add on to what Erin was saying and what she had mentioned earlier about like teachers and teacher training is a big piece of this, is just having the school already be an environment that's inclusive, that really values students' strengths, unique experiences, and you know that everyone has different strengths and different things that they're working on, and that's okay. And to create that environment like from the beginning makes it a lot easier than to have these conversations with students coming back to the school, and to have peers be more understanding. It's not always easy, and it has to be very individualized because everyone has a different way that they want to talk about where they've been and what they've been through.
What you said really resonated with something that we heard from one of our panelists yesterday, Jerica Coffey. I want to just read it out loud because I think it resonates with what you both shared in terms of that individualized approach. I'll just read it out loud. A youth-led reentry circle for students to share their needs and adults to make a commitment to support that young person to find a path forward, rooted in what that young person wants, right, and what they ask for. So just want to give a shout out to Jerica, again, one of our panelists yesterday, and we'll have another session tomorrow, but kind of similar conversations, right? These transitions between institutional settings and how we can hold space for the young people and also for families and teachers, like you were mentioning, Erin, with the training, the education, and how we can uplift this conversation before the crisis happens, and then maybe during, and also, of course, after what we're talking about today. Erin, I'd love to ask you a question, and Erin, please jump in as well. Olivia, how can schools balance the academic expectations with the students' ongoing health needs, kind of on the clinical medical side and also on the school expectations side? Can you speak to that a little bit?
Yeah, definitely. Like I mentioned, that month after discharge from the hospital is a really high risk time. And so medically, what I always recommend is to reduce academic expectations as much as possible. And the focus should be mental health, recovery, just adjusting to being back home. A lot of times what we'll recommend is like a partial return, so like part days and missing like certain classes, or missing certain days out of the week, only going a few days during the week. And that's something that really has to be like worked through with teachers, right? Like a teacher shouldn't have an expectation that a student is going to complete all of this makeup work from the time that they missed, plus like additional assignments. It really needs to be emphasized that like whatever is like the minimal amount that needs to be done should be what's expected. And then we can slowly add things on as we see how the student is doing and what they're feeling comfortable with. And sometimes that means like maybe a delay in graduation or a delay in promotion or a need for like summer work or something like that. But if it can be taken slower, like I'll always emphasize to the student that that's okay. That like their health and their well-being is so much more important than them like quickly moving through their, their grade. And sometimes that can be really hard for a student and for a family and even for schools and teachers. But it's so important.
Those are such powerful points, really, that potential delay in the academic career to prioritize that social emotional safety and psychological safety. And we saw some of that in the collective journal as well. So it sounds like we have a lot of resonance there in terms of, and I imagine there's some coaching there with students as well in terms of the potential shame or embarrassment that might come from not being on track with the standard sort of traditional sense of what it means to be successful, right? I know personally for me, there was a lot of that shame and embarrassment, right, of dropping out for a whole year, going back to community college, and then finally transferring back to university and sort of feeling like there was one way to do college right. And a lot of stigma, self-stigma, societal stigma around that. So I really appreciate you bringing up that point in terms of, well, if we can't be well ourselves, how do we learn? How do we move forward in our academic pursuits and interests? And I think that leads nicely into another question in terms of Erin, curious about, and Olivia as well, please, this question's for both of you. What are some of those common misconceptions that you notice in your work? Maybe that's also you can answer that in any way you want, maybe students, family, and teachers. And Olivia would love to hear your perspective too. Yeah, go ahead.
I think there can be many of them at times. And again, what I want to explain, kind of similar to what I've shared before, is that there's not one common experience, right? There's not one specific way that students show up, in transitioning back to school, or like one way for it to be right or healthy or any of those things. There's such a spectrum of experience and need. So I often in my mind kind of think about it on opposite ends of that spectrum, right? So sometimes there's a misconception that the student can't do anything when they return to school, right? That like asking them to do anything could be harmful and stress them out too much, right? And we appreciate being thoughtful about their stress level and what they can manage. And there, ideally should be a clear plan about, how to work around that. But for some students, part of what they need and desire and that they communicate to us is that they want to be able to get back into some routine and rhythm that will help them feel more regulated and establish some more normalcy. That's part of like what they're looking and searching for as they're also still working on what's going on internally. So it would be a misconception to think that students aren't capable of doing any work and that having some work might not be helpful. And it would be a misconception to think, well, they're back at school. They got care and treatment. If they're here, they're ready to go. Like, let's get them, back on track. And, so we don't want to make either assumption. We really want to speak to our students and also understand that what they might assume is what they want or need at first might not be what's working for them. And so it's a good reminder that oftentimes we put a lot of energy and attention right away as they're coming in, but fail sometimes to continue to circle back and check in and assess, like, did the plan that we have actually work? Is it supporting you? Is this feeling manageable, right? So I think that's an important step in all of this. I think the other thing that I want to name that I keep forgetting to say out loud and that I saw mentioned kind of in one of the questions in the chat is I've been in this role. This is my 18th year that I'm starting at my school. And so I've had a number of experiences with students coming back into school from hospitalization. And what I can say, probably 80% of the time, there's been no communication. There's been no preparation. Like, because of the way the two different systems work, the hospitals and the schools, unless there are, authorization of disclosure of information forms being signed, unless there is like in my experience here in San Francisco, I don't have people from the hospital team reaching out to the school to say, we have permission to share information with you. Your student is here with us, and this is when we plan to get back. Like, I often don't find out that the student has returned to school until they're in my building or I see them here. I don't. So I just want to name for many of you out there, like, we're kind of talking about what is ideal and best. And the reality is it's often not that. So I just want to preface that if you're like, this sounds nothing like what it is, experienced here at my site, that's true for me as well. So sometimes we don't have the ability to do all the front work of coming up with the plans that are needed, or to like kind of prevent those misconceptions from kind of taking over what's happening. And I think even though that's really challenging and hard, it's always important to course correct, right? Like, if, things haven't been set up and put in place that will best support them, and then we learn that, it's okay to acknowledge and say, you know what, we didn't get this right when you got here because we didn't have all the information and communication we need. Now that we see and understand what's going on, let's really get together. Let's figure out how, to take care of your needs and your well-being as you come back into school, and really do a good job communicating with teachers and other staff about how to shift things. If, we're receiving the student without any of that communication and planning ahead of time.
Yeah. Thank you for uplifting that and the real talk about the reality and how we have these ideal practices and things we want to implement. And then there's also what you experience at your own school or in your local community. And you said 80% of the time, right? You're not having that communication, and there's that disconnect between the hospital and sort of the student's back. Well, what happened? And then kind of doing that reactive work, right? I'm curious, Olivia, what came up for you during this conversation?
This is like a huge sticking point for me, because I really believe that the schools 100% have to be involved every single time a student is in the hospital. And the fact that, and I saw in the chat too, that people aren't hearing from hospitals when their students are there is like such a failure of communication between these systems. And I do really think, I don't think it's on the school. I think it's on the hospital. Like they are the ones taking care of the student. They know that they're there and they know what school they go to. And so the release should be signed, and they should be calling the school to inform them of what's going on and why the student's not at school anymore. And even in an outpatient setting, I think, if I'm seeing a child in my practice, I get consent to talk to the school because I know that that's important. I mean, a student is in school, like what is it, like 20% of their waking hours, which is like the biggest like chunk compared to any other piece of their time outside of sleep. So it's just so important. The school is like, it's a structured environment. There's professionals constantly monitoring their behavior and what they're doing and who they're talking to. And so it's like such a useful piece of information and such an incredible support that I think the healthcare system hasn't really tapped into effectively. And so I do think it should be standard protocol for any inpatient psychiatric hospital to immediately have a release of information signed for the school and to coordinate a transition meeting. I mean, that's when kids do best, like from my experience on inpatient units, which I don't work on an inpatient unit anymore, but to like from day one to be in contact with the school. Okay, this is like about how long we think this person's going to be here. How can we think about like what it's going to look like when they go back, and then to have that meeting before they're discharged and really know what the plan is. That's when things really go the most smoothly. So yeah, a lot of like feelings come up because it makes me so like angry when people just don't do what we know it works best.
Right. I can imagine that's so frustrating too, wearing the hat where that communication between the school and the hospital is so critical, and yet there's not those structures or protocols or systems in place already. So it's this reactive aspect again, where you're sort of trying to figure out in real time what's going on. I'm curious what innovations or solutions you both might have in terms of, well, what can we do differently, right? I mean, Erin, you mentioned 80% of the time there isn't that communication, and it's sort of like, whoa, the student came back and this experience happened. We're sort of scrambling to figure it out. What is a potential idea or practice or solution that you might have? I mean, are we maybe going to empower all students to carry safety plans with them and transition protocols with them in their back pocket? So if they end up somewhere, right? Like what are some ideas or thoughts? Of course, this connects to policy and sort of bigger questions, but I'm just curious from your perspective, what thoughts or innovations might come to mind?
So frustrating because it could be such a simple solution, right? Like I want to take over the hospital paperwork and make sure that there's just a form there, like there's lots of forms that are being signed. Why isn't there just a form that's automatically there that is that release of information? So that opens up communication with schools. I think it's such a big systems issue, how our systems in our society work as these like separate entities instead of thinking holistically about the needs of the children and families. So yes, I want somebody who's on the policy side of these things to like, it's not like some really complex issue. It's like a simple thing that me and all the other folks in my role in the city constantly talk about, like how much harder it is to do right by our kids when we just don't have these simple things in place that allow us to be informed and prepared to support their needs. I think the other thing that I also want to mention, right, is parents are a huge part of this equation when we're talking about young people, because they are the ones that get to sign. They are the ones that get to decide as that person's parent or caregiver or guardian, right? And so I think it's also really important on the school side to be aware of the harmful impacts our institutions have had on people and communities forever, right? And that there might be good reason why parents are afraid or nervous to share information about their child with the school if they don't already have a trusting relationship established with the school community. I'm a parent. I know that I'm always holding safety for my sons at the forefront of my mind. And if I don't believe or know that my child will be respected and cared for in a way that I feel comfortable with, I might just choose I'm withholding this information. I don't want anybody to know because I don't trust that they're not going to have these misconceptions or, like all the words that you all generated in the group journal about all the things that can come up. As a parent, I might be worried about all of those things. So again, I feel like part of the ways we really do best by our students and families is thinking about everything we do, right? And how are we really intentionally building communities that feel safe and respectful, that honor people and their cultures and their beliefs and identities, and how do we always center that in our work, because that's what's going to like kind of lay the foundation to do all of these other things better when we find ourselves in crisis.
Really appreciate you uplifting the family piece of it. I'll offer a brief anecdote and then Olivia would love to hear your thoughts. Uh, when I transitioned back to school, to college from this hospitalization, my mom got ahead of the curve and got me signed up for student disability services and accommodations, right? So sort of that forethinking of, school's going to be hard, it might be a stressor, right? To your point, Olivia, of jumping back into school and that pressure that students feel to catch up and to try to be on track with their peers, right? And get those straight A's to then move on, and this sort of domino effect of sort of having fear about being behind because of this powerful experience. And so thinking ahead about those disability services or accommodations that might be helpful from a learning perspective, I found very helpful for me. And my mom was very much the sort of social worker on the family side for me, and that was always very helpful to have that allyship, to have that support and communication, which is its own privilege, right? To have that sort of family support, and where do we have those gaps with our students where they might not have that person in their life, that point person where there's that communication. So who might else that be? Olivia, do you want to add some more thoughts to this conversation?
Yeah, I think that's great. Yes, of course the family is a huge piece, and a lot of times the family ends up being like the parent ends up being the liaison, the point person, which I actually think is not really fair, because they're trying to navigate a system that they don't really know, two systems that they don't really know.
Right, right.
And for the families that can do it, that's huge. And it's incredibly beneficial. And we also have to know that there's some families that really have a hard time with that and really won't be able to do that. And so they're going to really need more support.
Right. And the family piece too, I'm just so glad that you uplifted that. And my family and I joke, my mom will joke, she sort of accidentally got her master's degree in hospital administration and healthcare management. And I went to an internship at a psych hospital, right? So learning from the inside out how the system works, whether we like it or not. And I'm so grateful that you both are here sharing your experience. And I would love to transition us to a brief Q&A with you, if that's okay. Read your question here. Is there something school staff can do to initiate or prompt the hospital to get that EOI and invite done, specifically when we are the ones that prompt them to visit the ER? I have a parent packet and can include an ROI or a letter that the parent can hand off to the hospital staff.
Yeah, so usually the hospital systems have their own release of information that they want parents or patients to sign. So it has to be that specific release, and you can usually find it online. So if you're really having a hard time like getting them to acknowledge that you want to talk to them and have the meeting, I would find it online and print it out and have the parent sign it and then like send it to the hospital. Otherwise, I mean, a lot of times parents do prompt that meeting. If it's not prompted by the hospital staff, they'll say, I really want you to talk to the school. Like, what can we do to make that happen? And hopefully the team in the hospital wouldn't be resistant to that. But yeah, usually it's either through the parent, or you can also just, have them sign the release yourself print it out and just have them sign it.
And I want to uplift what Lior dropped in the chat too, going back to that family aspect, naming too that some kiddos are in need of hospitalization because of shared family trauma. The assumptions that all family members are resourced to support their kids need to be unpacked too. So thank you, Lior, for lifting that up and really thinking of the environment that we come from, the cultural aspects of that, as you mentioned, the family trauma, and those homes might not be safe spaces to be resourced. So thank you.
And also, and Amanda, feel free to come going back in if you want to share anything else about this next few parts, but we have various documents and examples. And I think Aaron said this quite a few times, that there's not a one way, there's not one child, there's not a one family, and there's not one way to serve and support the students that are coming back and transitioning back. However, we wanted to share just some checklists and some supplemental resources that we've curated that may be supportive as you're both searching for these and also curating and creating your own in your own spaces. And so the next few slides, when you view the deck, you'll just see some of these action plans and transition plans and hopefully some of that language around how do we support, and both the academic and the social emotional, how do we support and keep moving forward with that level of support. And then the last couple of slides that you will see once you have an opportunity to view this, we'll go back 2 slides. And I just want to briefly touch on this. So a lot of these tips were covered today. A lot of these tips were shared, and we just wanted to offer you a few that we feel maybe some like ones you can hold on to. And so these are school and that institutional systems level tips. I know a lot of the conversation today led to that systems level support being needed in order to then move on to the individual support. And so these are 5 tips. And on the next slide, we are offering you all tips on at an individual level. At an individual level, how can you as a staff member, or how you can share this with families to get that individual level support and be that support for the students and youth transitioning after hospitalization. Thank you all. Thank you, panelists. Thank you, Amanda. And we look forward to seeing you again tomorrow.